Dental implants are the most common method used to repair lost teeth and restore dental function. It's an extremely lasting and effective treatment for patients who lost a tooth or several teeth because of trauma or decay, as well as other dental concerns. In this clip, we'll discuss the different options available prior to the, during, and following surgical treatment for a dental implant. Before surgery. If you are considering having dental implants prior to undergoing the procedure, you must talk to a qualified oral surgeon or dentist that has a specialization in implantology. At the beginning of your consultation, the dentist will carry out a thorough assessment of your jawbone, mouth, and general oral condition to determine whether you are an appropriate patient for this procedure. The dentist will then go over your treatment options in detail, discuss the advantages as well as the risks associated with dental implants, and will address any concerns or questions that you might have. In a few cases, additional procedures, such as dental grafting or sinus lift, might be needed to guarantee that the success of dental implant operation. These procedures improve the strength and stability of the jawbone. This creates a strong foundation for implant. During surgery. When you go to the procedure, you'll be administered local anesthesia to reduce the pain of your treatment to reduce any discomfort that may occur during the procedure. If you're anxious, the dentist could offer sedation alternatives that will help you relax and be more relaxed. Implant surgery for the dental tooth generally involves multiple procedures. 1. Dentists will make an opening in the gum tissue in order to expose the jawbone. 2. A small hole is created in the bone and then the implants will be put through the bone. 3. The implant is then placed in a position to be integrated with bone tissue surrounding it through the process of osseointegration, which can take several months to finish. 4. When the implant is joined with the jawbone, it is connected to a piece of connector known as an abutment will be bonded to the implant. Then an implant-supported dental bridge will be inserted on top to finish the repair. The time required for the procedure depends on the quantity implants that are placed and the degree of complexity in your case. A majority of dental implant surgeries can be finished in just about an hour, and patients are usually able to be back home within the next day. After surgery. After the dental implant procedure, there is a tendency to feel discomfort or swelling as well as bleeding in the region of treatment. Your dentist can prescribe medicines or anti-inflammatory medication for these conditions. You must comply with your dentist's post-operative guidelines meticulously to speed up recovery and minimize the likelihood of developing complications. While recovering during the recovery period, it's important to follow excellent oral hygiene habits in order to keep your mouth clean and protect the longevity of the dental implants you have. There is a possibility that you need to adhere to a gentle diet for the next few days. Also, be careful not to chew near the implant area so that it can heal properly. It is important to make follow-up visits with your dentist in order to track the condition of your implants as well as deal with any concerns or problems that might arise. Your dentist will examine the functionality and stability of your implants and perform any changes or adjustments in the event of a need. Implants for dental purposes are a secure and efficient alternative for replacing missing teeth while restoring a beautiful, happy, comfortable smile. When you are aware of what can be expected in the lead up to, during, and after your procedure, you'll be able to be prepared for a favorable procedure and experience the benefits of dental implants over the long time to follow. If you're thinking about surgical treatment for dental implants, you should consult an experienced dentist for more information about treatment options and to develop a custom treatment plan that is suited to your requirements and objectives.